Welcome, everyone. Thank you for joining our webinar this afternoon. This is a four-part series about navigating transition and assistive technology across the lifespan. Today, we'll be talking about navigating early intervention and transition to preschool, getting from IDEA Part C to Part B. Next slide. My name is Michelle Schladant, and I'm an assistant professor of clinical pediatrics at the University of Miami Mailman Center for Child Development. I'm also the project director for Step Up AT, which is a federally funded grant. We have developed a professional development toolkit for teachers to help them support young children with disabilities in the classroom to support early literacy instruction through the use of assistive technology. And I'm also the project director for the South Florida Regional Demonstration Program through Florida's State Assistive Technology Program. I am presenting today with Kelli Fontaine. She's a co-investigator of our Step Up AT project and founder of Assistive Technology Consultants and owner of Learning RX St. John. Next slide. Ms. Fontaine is self-employed with Assistive Technology Consultants, and she's a paid consultant for FAST. And I am employed by the University of Miami, and I do not have any other financial disclosures. The contents of this presentation were developed under a grant from the U.S. Department of Education. However, those contents do not necessarily represent the policy of the U.S. Department of Education, and our project officer is Anita Vermeer. Next slide. Today, we'll be talking about laws and terminology related to transition and assistive technology services for infants, toddlers, and preschoolers. We will walk you through the steps in the transition process and identify key AT considerations when providing services to young children with disabilities. And we'll also share some resources for acquiring assistive technology tools and services. Taking into consideration what's going on in our world right now, I just wanted to briefly mention some COVID-19 considerations. There's a lot of information going out there in the internet about special education services and how COVID-19 is impacting those services. And according to the Office of Special Education Programs, school districts and state agencies must provide services while ensuring the safety of the child. And what teams must do is they must be flexible in determining how best to provide those services. So thinking about the best ways to use distance learning, teletherapy, low-tech strategies such as activity packets, schools while ensuring safety. If a school is, if there's a school closure, children who are receiving special education services need to abide by those school closures, and so they would not be receiving their special education services. However, once school is back in session, school teams must consider how they will deliver those services to children with disabilities who are receiving special education services. So those are some important things to consider during this time in our world. Next slide.
When discussing transition, a good place to start is to understand what transition is. Transition refers to the process of change and includes events that occur when a child moves from one setting to another. In today's webinar, we will focus specifically on what transition looks like as your child moves from receiving services at home to receiving services in a public school or community setting. Some may view change as a time of growth and opportunity, but for others, transition can be incredibly stressful and challenging. It's our hope that knowledge of the transition process and how to navigate it will help to empower families and facilitate a smooth transition from early intervention services to early childhood programs.
So to determine if a child has a developmental delay and is eligible to receive services through early steps, the evaluator will take a look at the child's development in the domains that I just mentioned to you, and usually they'll utilize a standardized assessment in order to determine the child's skill level in each of these areas. If a child demonstrates a delay, 1 to 1.5 standard deviations below the mean in 2 or more domains, or 2 standard deviations from the mean in 1 domain, then that child would be eligible to receive services. So they're basically looking for significant delay in either 2 or more domains, or an even more significant delay in 1 domain. There is an option called informed clinical opinion. And so a child may also be eligible based on informed clinical opinion. And what that means is that the evaluator will take into consideration knowledge and expertise of the team, and that also includes the family, and any observations from multiple sources and/or settings to determine the need for early intervention services. So even if a child, based on a standardized assessment, does not necessarily qualify for services based on the standard deviation, the evaluation team can utilize informed clinical opinion in order to meet eligibility for that child to receive services. And then lastly, if a child has an established condition, such as, let's say, Down syndrome, that may result in a developmental delay, that child also would be eligible to receive services. Next slide. So once a child is eligible for early steps, or Part C, early intervention, the first step is to coordinate a team of service providers to address the child and the family's needs. The service provider team will develop an individualized family service plan based on the family goals and their desired outcomes for the child. The early steps team will determine or select a primary service provider for each child, and that will be a central point of contact. And this person can be a therapist or other licensed professional, or an infant toddler developmental specialist. And so this primary service provider would be the one implementing the services for that child and family. The primary service provider is selected based on the needs of the child and the family, the child's IFSP goals, and expertise in the areas of needed support. And then lastly, family-directed service delivery means that services will be provided in the child's natural environment. So basically where that child would be interacting if he or she did not have a disability. So oftentimes the natural environment is the home, but it also could be a child care setting or in the community. Next slide.
According to federal law, IDEA 2004, Part C, after age 36 months, your child's no longer eligible to receive services through early steps. However, any child who is expected to continue to need services as they leave the early intervention program is potentially eligible to receive services through the school district's pre-K program or other early learning services in their community as part of IDEA Part B. It is important to know that your child may not qualify for the same type of services from the school district that he or she received in early steps. Remember, early steps provides more family-directed services. You will continue to be part of a team that makes decisions for your child. Next slide. So who is eligible to receive IDEA Part B services? A child can receive special education and related services if they're found to be eligible under any of the categories listed here. However, having one of these disabilities doesn't automatically qualify a child under IDEA. To be eligible, a student must have a disability and, as a result of that disability, needs special education to make progress in school. Each one of these categories has its own set of eligibility criteria, and the team will decide, and parents are very much a part of that team, which category best describes the needs based on the results of the evaluation and other documentation. The key thing to remember here is that a child's individual needs determine what services they receive, not their disability category. Next slide. Let's talk about the eligibility process for Part B. The local school system is responsible for determining eligibility for special education services as part of the IEP meeting. The IEP team includes family, teachers, administrative personnel, and related service providers. And the goal of the IEP meeting is to document identified goals and identify all programs and services the child will receive as part of the Individualized Education Plan, or IEP. Once the school district receives notification or a referral for services, they have 65 days to conduct the eligibility meeting. All additional evaluations or screenings really need to be completed within that 65-day window as well, because during the meeting, you will review all of these results and use this information as well as other documentation to determine if your child is eligible to receive services. Next slide.
So to summarize what the differences are between IDEA Part C and IDEA Part B is that, the biggest difference besides age, Part C is focused on children birth through 36 months. Part B is 3 to through the child's 21st birthday, is that in Part C, the services are family focused based on the family's needs and what they need in order to help support the child. Whereas when transitioning to IDEA Part B, the focus now becomes more on the child. In Part C, eligibility, as we mentioned, is going to be based on whether or not the child has a developmental delay or a condition that's likely to lead to developmental delay. And in Part B, the eligibility is based on whether or not the child is eligible to receive, fits into one of 13 categories of disability. Part C, the individual plan, is called the Individualized Family Service Plan, and in Part B, it's called the Individual Education Plan. Next slide. While family involvement is part of both Part C and Part B, in Part C, family members participate in all team meetings making decisions about the child's services, and they receive services to improve the family's ability to meet the needs of their child with a disability or developmental delay. In Part B, family involvement is parents participate in all team meetings, and family involvement is encouraged throughout the entire process. But the focus shifts more to child needs. The location of services in Part C is the natural environment and include the home, childcare, or community. And in IDEA Part B, it's oftentimes delivered in a school in the least restrictive environment. For Part C, the cost of services, states may charge fees for services through the child's insurance or Medicaid, and Part C will be a payer of last resort. In Part B, all services will be provided for free. Next slide.
So if your family is receiving early intervention services under Part C, planning for the transition to Part B will happen before your child's third birthday. Your team's going to work with you to help make sure the transition is as smooth as possible and you're comfortable with the plan. The transition plan is part of the Individualized Family Support Plan under Part C and will document the steps and supports that will be provided to a child and their family to help them get ready and prepare for the transition. In order to help school districts plan for services for your child, Early Steps is required to notify the school district's pre-kindergarten program that your child may be eligible to receive services no less than 90 days prior to your child's 3rd birthday. That said, parents do have the option to opt out of having this information shared with the school district if they don't want to have their child receive services. And yes, you can change your mind. Parents can change their mind at a later time. At least 90 days prior to the child's 3rd birthday, the IFSP team must develop a transition plan and hold a transition conference. And this team includes Early Steps service coordinator, the parents, and a representative from the school district, as long as the parent approves. During the conference, the team will review program options and discuss issues related to transition, such as assistive technology or related services that may be needed. Next slide. So IDEA says that children who receive special education should learn in the least restrictive environment. This means they should spend as much time as possible with peers who do not receive special education services. Where a child will receive services, also referred to as the educational placement, is determined during the IEP meeting. When a child is part of the typical preschool environment, this placement is referred to as inclusion or mainstreaming. Typical preschool placements may include government-run programs such as Head Start, private preschools, and community-based childcare programs. Mixed placement is when a child attends the typical preschool setting part-time and the special education setting part-time. The special education placement is when a child is placed with other children with disabilities for a majority of the school day. The out-of-district placement occurs if the child's home district doesn't have the appropriate classroom or staff or resources to meet the child's needs. In that case, an out-of-district placement may be necessary. The special education placement means the child is placed with other children with disabilities for a majority of the school day, as stated before. Some private schools have been approved to provide services to children who cannot be appropriately served by public school special education programs by nature of their disability, as well as specialized school placements. And home environment, in some cases, that's where the home is sometimes the least restrictive environment. When this placement option has been determined to be the least restricted environment, a special education teacher or therapist will visit the home to provide the services and supports that are identified in the IEP. It's important for assistive technology and services to be considered as part of the transition process. Assistive technology services include assessing a student's need for AT, training the child, teacher, and family members how to use AT, and evaluating the child's experience with various AT tools. Infants and toddlers learn by interacting with people and objects in their environment, and disabilities limiting a child's ability to explore the environment may cause delays in physical, cognitive, communication, social, emotional, and/or adaptive development. Assistive technology includes tools, devices, and services that enable children to engage more fully in activities and routines at home, in school, and in the community. Next slide. So AT can improve participation and independence by making activities and routines easier. For example, a child with a cognitive delay may benefit from displaying picture instructions for daily routines, such as washing their hands by the sink in the classroom. Using bowls with suction cups to provide more stability may assist a child with limited mobility. You can use a visual choice board with a choice of calming activities when a child is feeling upset. And providing switch-adapted toys to increase participation may be helpful for a child with a physical disability. For some children with disabilities, learning new skills can be a challenge. Assistive technology is redefining what is possible for infants and toddlers with disabilities or developmental delays. If a child with a disability is having trouble participating in classroom activities, assistive technology may be needed to help support that child. AT can be simple or complex and may be used to increase participation and inclusion in classroom activities. For example, for a child with motor delays, popsicle sticks can be added to the pages in a book to help a child explore a book independently. And interactive storybooks with picture manipulatives can help a child with cognitive delays understand the main idea of a story. Pairing a communication device with a book can allow a child with a language delay to participate in circle time. Next slide.
So when is AT considered in transition planning? So first of all, a child can obtain assistive technology if they are eligible to receive Part C services. If they are not eligible to receive Part C services, infants and toddlers can receive assistive technology through their insurance, either Medicaid or private insurance. For children who are eligible for Part C, parents or anyone on the team can request assistive technology as part of the IFSP meeting. If the IFSP team meeting decides the child will benefit from AT, then Part C will cover it as a payer of last resort. Training for parents and providers can also be included in the IFSP so that parents and providers can learn how to use the assistive technology tools that are listed on the IFSP in order to meet the family goals. Next slide. One very useful and easy tool that teams can use to help make that decision about whether or not a child would benefit assistive technology is to utilize what's called the Sett Framework. And in the Sett Framework, the S stands for student, and in the case of early intervention, we look at what are the child's strengths, needs, and interests. Once we determine information or we collect information about the child, then we need to look at the environment. And in the environment, we need to ask, where do we want this child to be participating more? So for example, a family may want their child to be able to make choices during mealtime, or they might want their child to participate more independently during mealtime or during a bedtime routine. Once the team determines the environment where they want the child to be participating more, then the team needs to ask, what specific tasks do we want this child to be able to do that maybe they have difficulty doing because of a developmental or delay or disability? And so here during mealtime, we may want a child to be able to make choices. We may want a child to be able to feed him or herself more independently. Or in the case of a bedtime routine, we want a child to be able maybe to turn the pages in a book. So once we determine the task, then we can start looking at what tools, AT tools, and strategies are needed. So in the example of a mealtime routine, in order to make choices, we may decide as a team to use a communication board with some of the child's favorite foods in order for the child to be able to choose what he or she wants to eat. Or we may use an adapted spoon in order to help that child learn how to feed him or herself more independently. In the case of a bedtime routine, we may, like in the example before, add popsicle sticks to a book in order to give that child the opportunity to be able to turn the pages in a book more independently. And so once we determine the tools, we can then list those items on the child's IFSP or IEP if they've transitioned to Part B, and then we can determine what staff or parent training is needed in order for those individuals to learn how to use that assistive technology to support the child. Next slide.
So when considering AT, it's helpful to provide a description of any AT your child currently uses and how it's used, as well as how the assistive technology or any new assistive technology will be needed in the educational setting. To assist with the transfer of assistive technology, provide any information you have concerning the AT, including steps for using and maintaining the technology, user manuals, support documents. You want to make sure to identify key personnel and establish the roles and training needs of all team members, everyone involved in using the assistive technology with the child or the strategy. Consider who will be involved with the training. How are you going to access funding options? Provide ongoing support. How's that going to be provided? And make sure to do follow-up activities, including assessments and evaluations. How's it working? What's the progress? And what's the timeline for implementation? So the Florida Alliance for Assistive Services and Technology, also known as FAST, is the state of Florida's #1 resource for assistive technology. FAST provides information and assistance, AT trainings, AT demonstrations, device loans for assistive technology, and funding assistance for assistive technology devices. The FAST Information and Assistance Program is a statewide assistive technology help desk that receives questions from all over Florida about programs and services related to assistive technology. FAST offers 6 regional demonstration centers throughout Florida. These centers maintain a diverse inventory of assistive technology devices and offer demonstrations of these devices to individuals to help them to make an informed choice about what type of assistive technology may work best. The FAST New Horizon Loan Program is an alternative assistive technology finance program that's available under the Assistive Technology Act of 2004. And the purpose of this program is to assist individuals with disabilities with financing assistive technology at reasonable interest rates. The Step Up AT Device Lending Library is available on the FAST website and offers a variety of AT devices to assist young children with disabilities, and these devices can be borrowed at no cost. Matt Holloway is the Director of Operations with FAST, and he's going to demonstrate how to access the lending library to borrow a device. Matt?
Thank you, Kelly. All right, now I'm just making sure we've got the screen up. As she said, my name is Matt. I'm the Director of Operations with FAST. That kind of encompasses IT and a lot of other things. Kind of facilitate a lot of these trainings as well. Let me kind of walk you through how to access the Step Up Lending Library and see what's all available in that lending library. First step would be going to the FAST website, and that's faast.org. At the top of the page, you'll see a menu option, programs. Underneath that would be the Step Up AT program. I'm going to click that and move through. Now on this page, it kind of gives you a breakdown of just basics, what Step Up is, a link to the Step Up AT website where the modules and trainings for them are. And then down below that, we have the devices that are available from the Step Up library. Now the Step Up library, our device lending library, is designed to work just like a online store would work, just to make it simple, easy, understandable for just about anybody to use. If you would just click on one of the devices, just using these Step Up adapted books with the plush props and other things that come along with it. On everything, we've put up here just showing you what the cost of the item is, and then the fact that it's actually costs nothing to borrow it. That makes it very easy, user-friendly, and we pay for the shipping and everything for that to go to you. For this one particular item, we have the book here. There are other options for the book available. And it'll tell you whether it's in stock or if it's on back order. If it's on back order, it's probably most likely on loan to another individual. I encourage you to go ahead and, even if it's on back order, go ahead and process it, kind of put you into a waiting list to be able to get it as soon as it comes back in, as soon as we get it checked in. In some cases, we may have multiples of that item that we can kind of work on and get that out to you. But just like you would do it on a regular online store, just add the device to your cart. I'll give you the confirmation here. I'm gonna go ahead and view the cart. It's already got my account information on here, which has our office address. You can create an account on the FAST website and go ahead and put all your information in, and it'll automatically populate that for you. Oops, looks like I've already had something here. You'll put your name, address, everything in here, specifically your email address and telephone number. We may need to contact you for some information. And lastly, one of the only requirements for the lending library is a state of Florida ID. If you do not have one, just give us a call. We can work through something to do that for you. But it's really just going to a file on your computer, an image of your ID, and loading it up. It could be a PDF, etc. If you're doing this from a mobile device, a cell phone, or a tablet, this option works really well. There's even a button that you can just take a picture of your ID, just straight through the process. And once you're finished with that, agree to the terms and conditions. It just states that you understand the device is being borrowed and it's not being given away to keep, and place the order. Once you do that, Hannah, she works in our lending library. She'll get that email that the device has been requested. She'll get that packed up and sent out to you ASAP. And if anybody has any questions, I'm definitely open to answering any of those as well.
Matt, did you go over locations? Folks wanted to find a local regional demonstration center in their area?
Sure thing. At the top of the screen with the menu, we have a locations, and then we have our 6 regional demonstration centers. You can just click on the locations link at the very top, and it'll open up, give it a moment to load, the map of all 6 regional demonstration centers. Michelle is from the Miami Center. You can click on the location and find all of their contact information, address, telephone number, fax, email. Another neat little feature here is if you can actually search by your county, type your county in, and the center that fits your location would come up in there. I'm actually working on an interactive map that shows all the county areas to make it even easier to find your local center. That should be live within the next week or so.
Excellent. Thank you very much.
Oh, you're very welcome.
Well, thank you everybody for attending the webinar today, especially given everything that's going on. We really appreciate your time.